One of them tracks back about 500 years and one of them about 250 years. Why did I say one of them? Because it turns out that even though these are very, very large genes, there are 5,000 different words here and there are 10,000 different words in BRCA2. In the Ashkenazi population, there are 3 sites that are repeatedly mutated. And this is what we can know when we go to do the teen test. Instead of having to do the very profoundly expensive test, we can do a much easier version. All right. So here we go. This is the slide again, but let me just show you. This is my way of explaining. First of all, I didn't label these on purpose. This could be labeled mother or this could be father. So you see it could come from either side. And then these are basically the 4 different possible combinations, and it basically shows you if you're a gene carrier, your offspring have a 50-50 chance. Family tree. I love drawing these family trees, but let me show you, this is one example. I brought an example not of a family tree that shows a profound number of dozens and dozens of cancers, even though we have many examples of those, but because there's nothing here that should have really drawn our attention. This girl came to me, or should it have? This girl came to me when she was 33 years of age. That's why there's a pointer there. She has a brother and she has a sister. Her sister was originally diagnosed with breast cancer at the age of 30. Her sister's still alive. She actually sees me also, but she hadn't seen me at the time. And her sister is Ashkenazi. All right, so I already showed you the chart that show any woman under 40 who's Jewish should be considered for testing. Her sister's doing okay, but look what happened 2 years later. Her mom developed ovarian cancer. Her mom's not okay. So this is a very sad scenario because we didn't have a lot of family history. She wasn't in my care. She developed a breast cancer at a young age. No one thought to test her. And there was an opportunity lost here to prevent ovarian cancer, as I'm going to show you in a second, in this mom. The sister came to me, she finished her testing, and she finished having her family, is now going on to do preventive work. I'm going to show you this slide at the end because I think it's a great example of a story. But here's another story. The only thing that was going on is that this mom showed up with breast cancer at 83. That's the patient that came to see me. And her daughter had died some years ago at 45. She was treated at Morrell Sloan Kettering, leader for this field. But it was before this testing was understood. Nothing was done. Okay, mom's doing okay. What's the big deal? But look at this. There's granddaughters coming along here. What's going to happen to them? So we're going to use that example later on at the end. Okay, so all of that is being said, but let's face it. Who wants to know you have an 80% chance of getting breast cancer? I mean, I'm sure all of you have seen the articles. I was even quoted in Newsweek recently by one of these articles about women who go out and have their breasts removed. So dramatic, so frightening. Seems like so much to do just from a blood test. I agree with you. I think one of the advantages for doing this kind of testing in our center is that we're not a surgeon and we're not sort of biased towards let's operate, even though that may be a reasonable option for many women. We give you the whole range of options, and there are some other options, and we're going to talk about those. So one of them is surveillance, one of them is prevention with hormones, and obviously prophylactic surgery. The other thing, though, and the thing that's really important, it has to do with the ovaries. I would gather some of you know somebody who's had ovarian cancer. You know this is a very difficult disease to fight. Even if you're screening the best we can, 80% of these women are going to be diagnosed at stage 3, and they're going to eventually succumb to their disease. A completely unacceptable outcome. Well, we learned that if you remove the ovaries in a surgery that can be done laparoscopically,